So now I would like to request our chairperson to tell something and conclude this session 1 and welcome to session 2. Thank you all.
I want to know what is the lowest age in your study series? What is the lowest age of patient in your study series? Professor Afroza, 7.5 months. How you diagnose seizure? Whether you have CT scan or MRI, and what are the cause of seizure? Neuropsychiatric manifestation due to actually occurred both due to the disease process and as a result of treatment effect. Another, 51% patient undergone remission. How long it took to take remission? And what do you mean by remission, both clinically and histologically and biochemically?
Sir, mainly clinically and biochemically. Histological remission we have not done. Rebiopsy was not done, sir. Sir, you know those patients also.
Thank you.
Patients were
Thank you very much.
Patients were under your treatment, sir.
Thank you very much. I am requesting Professor Mohammad Hanif to conclude the session.
Thank you very much, Professor Habib. I thanks to the organizer, particularly Professor Brigadier General Mamun Mustafi, for inviting us to session this year. We have a very two speaker. They have presented their experience. They have shared their experience. First speaker, Professor Afroz, she has mentioned about the lupus, in particularly in pediatric setup. Is very sometimes it's very difficult to diagnose it because when they came to the nephrologist, it's late. Some of this they've been seen by the rheumatologist. Even some of the patients when they presented with the other symptoms, even lupus, particularly in the pediatric cases, is very late in presentation because of delay in diagnosis. Main important things we face, particularly pediatric nephrologists, is the follow-up. Like that of the adult, they are coming to the hospital by themselves is possible, but for pediatric patients, they need parents to come or parents to accompany with them, which include their financial more constraint for them, and including the patients. So most of this, particularly in the kidney patients, we face problem in the pediatric setup, long run, because this is a chronic disease, is not continued for a long time because particularly follow-up. And moreover, this lupus patients, when we are giving the immunosuppressive drug, we need to follow up the patients. We need to follow up from the serological test, or particularly when we give the hydroxychloroquine, we need to follow up the yearly eye checkup. This is sometimes we face the problem. And in pediatric setup, we know that compared to the adult, the lupus patient, the mortality complication, that's the most higher than the, and development of the CKD much higher than the adult patients. We have to cautious about this. Now, second speaker about the Dr. Abdul Qadir, he has presented very excellently his experience regarding the management. For peritoneal dialysis is available in all the setup, particularly hemodialysis setup, still we face the problem, particularly dialyzer, blood set not available, and the companies, they are not willing to share because the number of the pediatric patient is very low. That's why they are not very much willing. So it's very difficult to manage the hemodialysis setup. Moreover, CRRT, which is very expensive, is also very difficult, and we are actually sharing with the adult, particularly for pediatric patient, we cannot by itself can continue the CRRT patient. But still we are coming gradually to develop all these things. So thank you all for patient sharing, and also for this excellent presentation. Thanks to the two speakers. Thank you very much.